Good afternoon to our professor, Ma'am Carmela Del Rosario. So for today, I will be doing a storyboard on how to correctly perform a urine pregnancy test, a Leopold's maneuver, a fetal heart monitoring using a stethoscope, and postpartum maternal physical assessment. Lastly, we are going to have the postpartum maternal physical assessment. Purpose: to fully assess a postpartum mother, thereby preventing complication after delivery. Assessment: client's level of consciousness and ability to follow instructions. Methods and date of delivery. Number of postpartum days. And vital signs of the mother. So now, let's proceed to the procedure. Step 1. Identify the correct patient. Make sure you use two patient identifier such as patient's name and birth date. Step 2. Introduce yourself and state the purpose of the intervention. Hi, I'm R. Stephanie De Guzman. I will be your nurse from 6 a.m. to 3 p.m. So for today, we are going to have postpartum maternal physical assessment. Step 3. Provide for the client's privacy to avoid the exposure of the body of the patient. Step 4. Set the bed to a comfortable height to work and lower the side rails where you will work. Step 5. Wash hands to prevent the transmission of microorganisms. Step 6. Check mother's vital signs and records, including blood pressure, respiratory rate, temperature, and pulse rate. Step 7. Wear gloves, a clean gloves. So first, we are going to have breast assessment. Step 8. Position the client in a supine or sitting position. Step 9. Open the gown. Exposing the breast to be examined. With the use of the hand, backhand. Step 10. Inspect for the consistency, nipple type, and integrity, swelling, redness, engorgement, and tenderness of the breast. After that, Step 10. Tie the gown. And now, let's proceed to the uterine assessment. Step 12. Expose the client's abdomen, covering the upper part and lower extremities of the patient. Step 13. Assess the tone, height, location of the fundus. So now, let's find out the fundal height. Immediately after birth, at the level of umbilicus. 1 to 2 hours after delivery, midway between umbilicus and symphysis pubis. 12 hours after delivery, 1 cm or 1 finger breadth above the umbilicus. 24 hours after delivery, 1 cm or 1 finger breadth below the umbilicus. 48 hours after delivery, 2 cm or 2 finger breadth above the umbilicus. 72 hours after the delivery, 3 cm or 3 finger breadth above the umbilicus. So now, let's proceed to the bowel assessment. Step 14. Ask client whether she moves her bowel or not, or whether Platus is positive or not. With the use of stethoscope, Step 15. Auscultate for bowel sounds of the patient. Step 16. Assess for abdominal distension to the patient. So now, let's move on to the bladder assessment. Step 17. Ask client for the voiding pattern, presence of pain, or burning sensation during urination. Step 18. Palpate for bladder distension. Step 19. Track fluid balance, intake, and output. So now, let's move on to lochia assessment. Step 20. Assess the amount of lochia. Note time of last perineal pad change and note for the amount of lochia on perineal pad. Scant, small, moderate, or large. If waiting perineal pads is 1 gm equals to 1 ml of blood loss. Step 21. Assess the number of days the woman has delivered her baby. Lochia rubra from the birth until 3 to 4 days postpartum, the odor should be fleshy like menstrual blood. Lochia serosa from 4 to 12 days, 2 weeks postpartum, vaginal discharge are brownish, pinkish in color. Lochia alba from 12 days to 3 days postpartum, vaginal discharge are yellow to white in color. Step 22. Document number and size of blood clot. Step 23. Turn patient to assess for blood loss under Botox. Step 24. Remove medical gloves and do hand hygiene. And lastly, the episiotomy assessment. Step 25. Wear sterile gloves. Step 26. Place the patient in lateral position with her back facing at you. Step 27. Expose the client's buttocks. Step 28. Inspect for redness, edema, ecmosis, number of stitches, consistency of discharge, and approximated edges. Step 29. Palpate the edges of stitches using either of your thumb or index finger, noting for the presence of discharge from the stitches and pain upon palpation. Step 30. Remove gloves, dispose or arrange used materials properly. Step 31. Record all data in the client's chart. Step 32. Refer any abnormal findings to the attending physician. That's all for today. Thank you so much.